Country 103.1 KKCY is the Sutter Butte's best country. I'm Dave Logassa. It is 7 minutes after 12. The annual Adventist Health and Rideout Foundation Golf Tournament is coming up Friday, May 1st at Peachtree Golf and Country Club. And Patience Boudreaux, who literally just got up and left, apparently it was something I said, along with who is the president of the Adventist Rideout Foundation, Heather Pena, the foundation chair, and Dr. Andrew Bellino, emergency room physician and director of emergency medicine, are all here to join us to talk about it a little bit. Thank you so much for taking the time. I know you guys are very busy. Let's start with Patience. If you pull that towards you just a little bit.
I promise I wasn't bored. I was just welcoming Dr. Bellino. Thank you for having us.
This year, the beneficiary of the tournament proceeds is the emergency room.
Yes.
I would expect that you guys get together and try and identify a need, and then decide that's what we're going to do with the dough each year.
Yes, we look at needs in our community. The foundation, Adventist Health Rideout Foundation, is dedicated to improving the well-being of the community. RED, Dr. Bellino won't brag about himself, but his team saw more than 77,000 patient visits in 2025. It is huge. We're the only emergency department in Yuba and Sutter counties, and it is such a resource. So we wanted to make sure that they had some flexibility to invest in projects that they really believe in, and so that's why we picked it this year.
Well, let me switch to the good doctor and ask him, what is it you guys need?
Oh, man, a lot of things. But I think
every doctor would say the same thing, I'm sure.
I think that one of the things we're really focused on right now is, just like Patience said, we're seeing more and more patients every single year. And actually, the new tower that was completed in 2019, the way they designed that was with an expectation that right now this year we would see 50,000 patients.
Oh, and you're way ahead
we're
of
already
that,
20,000 patients over that. So we've really outgrown the space. And so we're trying to find ways to make it still comfortable for patients, to make it a place of healing, to make it a place that everyone feels like they can come, get the care that they need. And so there's just a lot of equipment issues and kind of outdated things that we're trying to renovate in some ways to make it a better place for everybody.
It is one of the truisms of life, I guess, that almost everyone has a great emergency room story where a doctor helped them everything was, and then they all have an emergency room story where I had to sit there and it's nobody's fault at all except the system, so to speak. So are you looking to add like square footage?
No, not through this project. I mean, that would take millions of dollars essentially. So
make a better golf course, ladies.
Yeah. While that would be great, I think really what we're looking for is finding ways to get things to be more comfortable in the space we have. So one of the things we've done recently is we got new chairs for patients and their family members to sit in when they're sitting there and waiting for the hours that sometimes they can take.
Right.
One of the other things that we're really excited about is there's a portion of our emergency department that is currently used to take care of patients in psychiatric crisis. And currently it's designed as an emergency department is, with a bed, with oxygen, with different medical equipment that patients in psychiatric crisis don't need. So one of the things you could potentially do is change that space. And so rather than being built for patients with medical needs, it's built for patients with psychiatric needs. One of the advantages of that is not only does it help those patients feel more calm, comfortable, and get the care in a more appropriate setting, but it actually can increase the number of patients we can see in the same space. And so in that way, it would increase the capacity to take care of patients without needing the extra square footage.
Wow. I had not even thought about that, but it is something that I'm sure you guys deal with on a regular basis, if not every day. Yeah. And trying to figure out, I would think, in today's healthcare system and all that, to come up with efficient ways to do the things you absolutely need to do has got to be a big thing. And the fact that you are figuring it out is really impressive.
Yeah, so just thinking outside of the box, just like you're saying. So one of the big terms right now in healthcare is disruption. So kind of how can we disrupt this process to make it better and kind of think outside of the typical lanes that we've all been grown up in. So
I got it. Heather, tell me a little bit about the golf tournament itself. What can people expect when they come out there? I know this is, I don't want to say. What year is this?
34th?
Yeah,
35th.
35th.
All right. It's one of the first golf tournaments of the season, so it's really a super duper fun event. A lot of people from our community come out and just enjoy a great day of golf. We have had it be extremely hot. We have had it be extremely pouring down rain and cold. So we're hoping just for a nice, great day of golf.
So I know also that you're currently looking for sponsors. How do people sign up to either be sponsors or to be players?
If you reach out to me directly or patients, as well as going to Adventist Health Rideout.org/golf, you can sign up for a team. You can donate directly. And we always need volunteers as well.
Oh, so anybody like, I don't know, a big fat disc jockey who may not play golf could donate to this as well.
Absolutely. And we love people like you that will donate. And just a reminder as well, the golf tournament is Friday, May 1st.
Okay.
It is, again, at Peachtree Country Club, 2043 Simpson Road in Marysville. So it's going to be an awesome day of golf and to benefit the ED. Which
you guys do amazing work there and deserve all that you can get out of these ladies. Patience, one last thing. I try to do this with big important things. Is there anything I didn't ask that I should have?
Well, one of the things that we changed this year is that we're going to feature different restaurants across the course. So instead of having just one big lunch, we're going to have different tastings at every hole. So if you go to our website, you'll see all the restaurants that are coming through to support our emergency department through their generosity. And so I just want to highlight that that's a new thing this year, and we're really excited. Also, everyone in the community can participate in our silent auction. We're going to do it as a virtual platform. So even if you're not a golfer, you can still support by bidding on something.
All right. And Dr. Bellino, lastly, the pit. Yes, no?
I do like it. Actually, it's pretty good. The only problem I have with it is sometimes when you come home from work, it's too much like going right back to work.
Yeah.
So I have to take it in small sections. But no, I think
it's got to be
great.
a day off program for you, I would think.
Yeah, exactly.
Hey, guys, thanks so much for joining us today. We really appreciate it. Golf tournament's coming up May 1st. Go to AdventistRideout.org/golf to get signed up.